Probably the most common question these days, what the clinics are going to look like from January. Stay tuned. Good day, ladies and gentlemen. My name is Reza Roudsari. I'm the Director of Undergraduate Education at the School of Dentistry, University of Manchester, and thanks a lot for joining me on yet another episode of Manchester Molars. Now, these days, probably one of the most common questions I'm getting is what your clinics are going to look like from January. So what I've decided to do today is to go ahead and share my screen with you so you can have a look at the same draft document that I'm working on together. How's that? Now, before I do that though, I would like to credit three organizations. One is the Dental School Council, the second is the STSEP, and finally is the University of Newcastle, who between them, they produced a number of very good documents in the past couple of weeks, which really helped us to be able to get where we are now and hopefully from January onward. Now, so please come and join me on my screen and I will just go into a little bit more details when you're looking at my screen on my laptop. So what you can see here is just very briefly, essentially, this is your ground floor clinic looking from the top, this area there. And what you can see are the bays, starting from bay number 1. This is where the nursing station is. And then on the other side, you've got the dispensary area, which is opposite bay number 34. And it goes all the way to chair number 45. So we had some estate work and we realized for the chairs to be compliant with the current guidance, we have to have a minimum of 5 meters distance between the head to head of the patients when your chairs are in supine position. Therefore, out of the 45 available chairs, we can only use 14 of them for the purpose of AGP on the ground floor clinic. And what I've gone ahead and done is all the chairs which can be used for AGP, I put them the numbers in red and I grayed out the ones which cannot be used. Now obviously this is not applicable to the non-AGP, so rules with non-AGP is a lot more relaxed. And what we ended up doing was we just picked a couple of bays here for some of the non-AGP sessions. So the plan is for your morning sessions to have non-AGP in the morning, and then in the afternoon the same clinic will turn into AGP. I say the same clinic, same sort of clinic. Right, I will explain in more details in a second. And what we are hoping to then bring on the clinic are BDS year 5 and 4 as well as BSCs year 3 and 2. I'm hoping that at some point we bring BDS year 3 in as soon as the rules relax a bit and we can reduce the chair distance from the current 5 meter, but watch this space. So in the past 3 months we moved a massive jump now from our 3 or 4 current AGP to now 14. But anyway, so the way it's going to work is, let me just pick an example, a random day. How about we look at Wednesday morning, for instance. So on Wednesday morning we will have the course of year 5 as well as the BSc year 3 and 2 on the clinic, and this is how they're going to be panning out. So as you can see, the clinic is divided into 5 zones. Zone A, which is these 3 chairs there and these 3 chairs over here. We got zone B, which is looking after essentially 3 chairs over here, and then we got zone C looking after another 3 chairs there. I'm just not counting the gray ones. And then we got zone D, which again is looking after 4 chairs on this corner of the clinic. Zone E is non-AGP only, so it only activates on select morning sessions whereby we might have 2 or 3 chairs working for non-AGP there. So each zone will have its own tutor. So the tutor in zone 1 will be looking after 2 chairs there and 2 chairs there, essentially 4 chairs there. And then we will have tutor 2, which is looking after zone B, tutor 3 looking after zone C, and finally tutor 4 looking after zone D. And because the non-AGP, and in this session in particular we got zone E activated, we'll have a 5th tutor over here as well. So you have 5 tutors, each of them looking at 3 or 4 chairs. And you probably noticed that I tried to mix cohorts a bit. whereby each tutor is looking after, for example, here 3 BDS Year 5 and 1 BSc student, so on. Over here 2 BDS Year 5 and 1 BSc, and so on. And essentially what I'm trying to do is I'm trying to bring the IDT teams a little bit more pragmatically onto the clinics, so you guys can share patient experience and patient practice amongst your own team as well. So on top of the tutors for each of the zones, we also have got a tutor lead who is looking after that session. So we'll have a lead tutor who is a 6th person who's going to be on the clinic and essentially helping out with any of the tutors who might be slightly behind, looking after a couple of more complicated treatments, so they have to put a little bit more attention in one. So then the lead tutor can work as a pressure relief, and also he or she will be then responsible in organizing and coordinating the work of the remaining tutors. So then it comes down to you guys. So you guys are paired up with your own cohort. So year 5 here is 2 year 5 there, one of them as assistant, the other one as the operator, and obviously swaps every week. But whoever has got a day, so say for example the year 5 who is going to be in bay number 45 in this example, that person will have non-AGP session in the morning, so they can see 2 or 3 patients in the morning as non-AGP, and then they will see 1 AGP patient in the afternoon, and then on the following week their assistant will be doing the same. So the assistant will be seeing the non-AGP cases in the morning and then 1 AGP case in the afternoon, and so on for all the other cohorts as well. The only exception is BSc year 2 at the moment, unfortunately, is only on non-AGP. Because you guys still have got stuff to do on the clinical skills, and hopefully when things start to calm down a bit with COVID, then we will start introducing your AGP as well. But at the moment, from January, you're only timetable to do the non-AGP, but the rest of the cohorts are doing both AGP and non-AGP. So when we go into an afternoon session, for example a Monday afternoon here, so as you can see, we've got, for example, 9 pairs of BDS Year 5, 1 pair of BDS Year 4, and 2 pairs of BSc Year 3 on the clinic. And the way it's going to work is we will have a slightly staggered start for each of the zones. So you bring your patients in, and hopefully by 1:30, everybody has got their patients in the chair, so you can go ahead and check on the salute, double check the medical history, double check the consent, you make sure you've got all the instruments and materials you need ready. You start with all the non-AGP part of your treatment, for example, taking the impression, numbing the patient up, and you guys all get ready for your AGP. So then there will be a bell. At the moment we're thinking it's going to be around 2 o'clock, maybe a little bit sooner than that, but essentially when you guys are all done with your non-AGP part of the treatment, you start to gown up for the AGP sessions. So you will have your fluid resistant gown, as well as your FFP3 mask and visor, as well as an FFP2 mask on top of the FFP3, and your gloves all ready. And then when you're ready, you will tell your tutor, your zone tutor, that you're ready to go. Obviously your tutors start gowning up and everything, and then when all the 4 tutors are ready, they will thumbs up to the lead tutor saying that, okay guys, we are all ready, let's just start the session. And only when the lead tutor is happy for the session to start to become AGP, that's when probably a bell goes, like the OSCE, good old OSCE, and then we all start the AGP session. So the AGP sessions all start at a set time, and at the moment we're just fine-tuning how long you will have for an AGP. We are thinking potentially 90 minutes, which is going to bring you to around 2:30, whereby then there will be a bell to tell, like, everybody has to stop doing AGP procedures. So handpiece down, scaler down, etc. So just making sure you're not creating any more aerosol. And then you've got another half an hour to just finish the treatment, or temporize the treatment, make your temporary crown, take your final impressions, whatever you have to do, but all in the non-AGP. So as your patients are finishing, then there's a procedure in terms of how to accompany your patient to the exit door. Meanwhile, while the AGP is happening, all the doors are shut, so nobody can come in or go out. So if you finish prior to the 90 minutes, then you just have to wait for people to allow you to go out. And obviously, when your tutor is happy for you to let your patient go, and the lead tutor gives a green light, then your patients can leave the clinic. And you just come back to finish your notes. You still have to preserve all your FFP3 mask and essentially your AGP gears. And you tidy things up, you finish your notes, you do all your identity. And eventually when there is a bell to say, like, the fallow time for everybody has come to an end, then there will be a total wash down process. Now, because there are going to be too many bays and it's simply not possible just to use the nurses to do the wash down, unfortunately, part of the task is going to lie down on our students to, in a supervised manner, go ahead and try to do the wash down of their bay and potentially some of the neighboring contaminated areas. So that's at the moment what we are trying to plan, and as I said, we're just fine-tuning things, so there is still lots of discussion going on in the background, but I thought you probably deserve to know sooner than later, so you know that where we're heading from January. So this is pretty much it for this week. I think when I come back next week, I'll have some information on the COVID vaccine. Yes, the COVID vaccine is on our doorstep, and very soon we're gonna start vaccinating our 7 students. One thing just to keep in your mind is, obviously it's a huge project and we quite are in need of human resources. So at some point I'll be approaching you guys and inviting you, if you would like to volunteer and help with the project of vaccinating essentially the nation, starting from us, but then also going to the community. So watch this space and I'll be in touch very soon. So until next week and further updates, I've been Reza Roudsari, you've been amazing, and I'll see you all next week.